okay, this is going to, all right.
Hey, Mark. So welcome back to Doc Talk Live. I'm still trying to kick this thing off the ground, so I'm trying to make it real. If anybody happens to be watching live and they can type in questions, we're going to talk about knee arthritis, but you can type in about anything you want to type in on. Or if you're watching this later, you might want to message me and ask me things you want to hear about. I'm with Mark Rogers. Mark, thanks for joining me today.
Absolutely.
Mark is an orthopedic surgeon who specializes in sports medicine. I asked you to talk to me a little bit today about knee arthritis.
Right.
It seems like as we get in our 40s, 50s, and above, we get knee arthritis.
Right.
Maybe that's a good place to start. Is it genetic, or is it environmental? Is it both? I mean, I'm very active. I don't, knock on wood, I'm not
Right.
aware that I have any knee arthritis. I play a lot of sports. Actually, I'm getting some hip arthritis, I think.
Yeah.
But maybe we should talk about that.
That's right.
But again, how do most people get it?
Right, so that's a good point, and we don't really know, to be honest with you. It's probably a combination of all of those things. One of the things that we have learned is that, well, arthritis is a generic description that we use to describe any damage to cartilage in any joint in the body. So there's various types of arthritis. Usually we're talking about osteoarthritis, which, as you said, can be a combination of genetics. It can be a combination of environmental things. You know, everybody terms that one wear and tear, so our activities that we do on a daily basis, or it can just be a little bit of bad luck too.
I asked you to put up an X-ray so
Right,
folks can actually see what we're talking about, and maybe you could just point out the key
Right.
the key component there. Maybe use the mouse
Yeah,
if the mouse will work there.
We'll catch it up on there. So this is just an X-ray of a gentleman who's one of my patients who has some arthritis in his knee, and this is a AP view of the knees. This is actually a special view that we use to pick up some subtle arthritis in folks, and you can see that in these pictures, this is both of his knees. This is the tibia bone down here, which is the shin bone, and this is the femur bone up here, which is the thigh bone. And the spaces in between
Here and here.
is not, it's not air as it looks like on this X-ray. It's a space, but that space is made up with the cartilage and the meniscus and the other structures in the knee. This is his left knee, which is less affected. He doesn't have a lot of pain in that knee, but in this knee, you can see that he's got not a lot of space in between the thigh bone and the shin bone on that side.
It is bone on bone.
It is bone on bone, and that's where that cartilage wears away, and that's what we term arthritis. So that's what's going on in this knee. He's got some arthritis, particularly on the inside part of the knee, which is the most common type of arthritis that we see. And he has osteoarthritis, which is the wear and tear arthritis that folks talk about.
Let's skip to treatment.
Yeah.
Obviously, people are going to be aware of joint replacement. Is this person looking at a joint replacement?
This particular guy is. We've actually talked about it for some time. There's a lot of different options when it comes to arthritis in the knees, and to be a little bit more, a little bit brief, the spectrum goes from a lot of things that we call cartilage restoration surgeries all the way to joint replacement. Okay, so for folks that have minimal arthritis, or they have focal areas of cartilage damage, joint preservation or cartilage restoration surgery can be an option for those folks. Those typically tend to be folks that are younger than about 40 or 50.
And this is something where a sports medicine doctor like yourself would be really highly focused on.
Correct. Yeah.
And so let's stay on that topic for a second, since that's really something
Right.
critical that you would provide. Whereas,
Yeah.
you know, every orthopedic surgeon who's trained can do knee replacement,
Right.
but it takes, I guess, a specialized skill to sort of start thinking about cartilage replacement.
Right. So cartilage replacement is a special subspecialty within sports medicine that specially trained surgeons are able to do, and that's where we actually try to replace or repair cartilage damage that happens in either the knee, shoulder, elbow, other places.
And
like
how
that.
do you do that?
Well, there's various techniques to do that, okay? So there are some cartilage repair techniques where we use a combination of biologics, so that's like PRP stem cells, in conjunction with some new scaffolds that they're making that are on the market now, where we're actually able to put patches on the cartilage lesion in order to regrow cartilage.
Do you have to send that stuff out to a lab to regrow it?
Some of them you do. Some of them you can do it all in one stage, and you can repair that defect with a one-stage procedure.
With the one, so
Correct.
it just
depends on the type of lesion it is, or the type of cartilage damage it is, where it is, either in the knee or shoulder, and then.
And I'm curious, and I know this is sort of a little bit even further along than maybe even your skill set.
Yeah.
But I became aware that in some of these really Mayo Clinic type places, that they can actually do a knee transplant.
Correct.
Can you comment on that?
Yeah, so what this is, it's called an osteochondral allograft, and that's where we actually take cartilage from a donor, which is a cadaver donor, and it's fresh frozen, and we actually match it to the patient, and we'll actually take plugs or a lot of it and replace the damaged cartilage in those patients with that of the donor.
So it's not like you can chop out the
Right.
knee and
No,
put in a whole new knee.
Right, it's a focal area that we're able to use. Lots of times we're using what we call plugs. They're about 2 centimeter kind of circular plugs. Now, in some instances, if we have to do larger grafts, we can do that. It's a little bit of a different recovery and different procedure, but yes, you can even do larger sections than that.
Wow.
Yeah.
Well, we're going to stop there just because that's a lot.
That's a lot of information
for people to digest, and maybe we'll see what people's comments are, and perhaps they want to know more about bracing or injections, and we can come back and talk about that. Thanks, Blake, for recording this. Appreciate it. Mark, thank you.
Yeah, thank you.